Great to see everyone this morning. We'll give a couple more minutes for folks to roll in. Thanks for being here. So good morning, everyone. Thanks so much for being here today and joining this knowledge sharing event.
Good morning, all.
Good morning. My name is Heather Toma, and I'm the provincial animator for the Ontario chapter of the Coalition for Healthy School Food. And my colleague Carolyn Webb and I will be hosting this webinar today with Dr. Tina Moffat. And Carolyn will be monitoring the chat for us. And if you would like to, if you haven't already, go ahead and enter your name and where you're coming from in the chat so we can all see. That'd be great.
No.
Super. So, let's see. So as we start the session today, I just wanted to take a moment just to think about how school food is really a direct connection for each of us, and it can be, to the lands and waters of our communities. And my home is near here, Lake Ontario, on the traditional territories of the Mississauga, Anishinaabe of the Ojibwe Nation, near Alderville and Cobourg. And for me, having time to spend here along the waters of the lake really reminds me about change, and change being part of all the cycles of life, and helps me breathe through the highs and the lows of the work that we're doing in our communities to support change in food systems. And it also reminds me that we are part of a long lineage of First Nations peoples and settlers that have come through lots of change and challenges and lived in caring relationship with lands and waters to be offering foods for the well-being of their communities for many, many centuries. So I encourage you, as we proceed today, to just take a moment to reflect on your relationship with the land that you're on across Turtle Island, because we have folks from across many provinces and territories here today. And think about the caretakers of that land and your community, and any steps that you may already be taking or could plan to take towards truth and reconciliation. Thanks. So here's an overview of our agenda for the day. So we are happy to have the opportunity to learn about the research being done by Dr. Tina Moffat and her team, co-creating an inclusive and caring national school food program in Canada, parent and teacher perspectives. And as we proceed, I'll give a quick overview of the Ontario chapter of the Coalition for Healthy School Food, as well as the National Coalition. And then Tina will present her research for about 30 minutes. If you have questions during her presentation that are specific clarification questions, please feel free to ask those questions at the time. If you have larger questions about content or context, then save those or put them in the chat, and we'll have those addressed at the end of the presentation. And as was noted in the invitation, and as you see when you came in, this is being recorded. So we'll be able to share it out afterwards for participants and others. And so please do leave your camera off if you'd prefer not to be seen in the recording. And that's great. So I'm going to shift to, there we go. So the Ontario chapter, as many of you know, for the Coalition for Healthy School Food was formed in 2021 and is one of many chapters across all the provinces and territories in Canada. And we currently have over 95 members and endorsers in Ontario, some very new in the last few weeks, and some that have been part of the chapter since it began. And we are supporting folks to learn and connect and understand each other's work better, share best practices, and explore all kinds of opportunities to make sure that school food programs are robust and well supported across Ontario and across Canada. And so to do the across Canada part, we're supporting the National Coalition. And at the national level, the coalition has over, we think it's 330. It keeps changing quickly, but that's where we're at now. I think it's 330 members and then over 140 endorsers from every province and territory. And this is nonpartisan, and so we're collaborating with organizations and representatives from across the country, as well as researchers such as Tina. So it's great. We're glad to have Tina here today. So I will now stop sharing my slides and Tina will share hers to begin her presentation. But Tina is coming to us from McMaster University, where she is in the Department of Anthropology, and her research has been related to food and children over many years, and school food is one of the pieces of her research. So we're really excited to be able to hear about her work today. Thanks, Tina.
Thanks, Heather. All right, I'm just gonna share my slides with you. Can everyone see that?
Not quite yet. There it is. Yep.
Great. Okay. All right, well, thank you to everyone for coming out today and making the time to come to this webinar. I know you all have very busy days, so I'll get started with the presentation. So this is perspectives from caregivers and teachers in Hamilton and Peel Region. That's where the study was focused. And before I start, I just want to acknowledge the investigators of this study. So we were partnered with the Coalition for Healthy School Food, and Carolyn Webb, who is the Knowledge and Mobilization Coordinator at the Coalition, and I'm sure you all know Carolyn, and of course Debbie Field as well, were representatives in this project. And then myself from McMaster, and then also co-investigators Rachel Engler-Stringer from University of Saskatchewan, Tracy Galloway from University of Toronto, Mississauga, and Katerina Maximova from University of Toronto. And we were funded by the Social Sciences and Humanities Research Council of Canada. So today I'm going to give you a very brief background to the current situation in Canada with regard to the National School Food Program. I'm sure you're all very familiar with it, so I won't spend much time on that. Then talk about the study objectives and methods, then the findings, which consisted of 3 types of information collection: parent survey, parent focus groups, and teacher interviews. And then I'll finish with some recommendations that came out of the study, and then open it up for questions and discussion. So the current school food program situation in Canada, as investigated by Amberly Ruitz. This is from a 2024 publication. Amberly found that 52% of students across Canada have access to school food programs, and they break down into milk, breakfast, snacks, and limited lunches served. And as you all know, in 2024, the federal government announced $1 billion invested over 5 years to create a national school food program, which the money is the investment is partnering with provinces and territories and Indigenous partners. To date, I believe there are 3 provinces now that have signed on, and that's Newfoundland, Manitoba, and Ontario is the latest. And the National School Food Policy was also created by the federal government in June 2024. So that implementation of this program is going to be very complex, as I'm sure you all well know, and that's really what this study is about, to start having conversation about what that's going to look like. So the study objectives were to understand the current school food programs in Hamilton and Peel region. We did kind of a quick kind of overview of that using the survey and the focus groups with parents and interviews with teachers. And then we moved on to explore preferences and barriers for participation in the National School Food Program. We really aim to investigate parent perspectives from diverse backgrounds in Hamilton and Peel region. This also objective with this was just to share and promote ideas about the NSFP with stakeholders. So briefly, we did this study. The data collection really took place between April to June of 2024. We started with a parent online survey, and we recruited parents and caregivers through Facebook and the Hamilton Wentworth District School Board e-bulletin board. Unfortunately, the Peel District School Board has a policy of not advertising research studies to parents, so we weren't able to get them on board. But we did manage to get, actually, we got over 600 responses to this online survey, but many of them were not, either they were very partial and we couldn't really use them, or we actually found some bots and sort of fake responses in there too. So when we cleaned it all up, we had 267 usable surveys from, again, parents and caregivers in Hamilton and Peel, and we were targeting parents with kids in in kindergarten to grade 8. So just at the elementary level. Then we then did focus groups with parents. We had 27 parents in 6 different focus groups, and these were recruited from the survey, people who indicated that they were interested in participating in a focus group. And then interviews with teachers from the Hamilton Wentworth District School Board. We had 6 different educators from 4 different schools. Okay, so I'm going to start by talking about the findings from the parent survey. And just to give you a little bit about their demographics for this 267 people. So overwhelmingly, not surprising, but we had 82% of our respondents were women, 16% identified as men, and 2% as non-binary. The 69% said they were employed full-time, and 17% were stay-at-home parents, and 7% unemployed. We asked them to identify their ethnicity/race according to Statistics Canada survey and questions, and we categorized 70% as white if they identified as white, and then 30% racialized, that was anyone who didn't identify as being white. And 86% of our sample were college or university educated, some kind of either completed a degree or had participated in one of those programs. Household size, the majority were 3 to 4 people in a household. And we asked them, we actually did a 6 question food security module with them on the survey. And from this, we determined that 57% were living in food secure households and 43% in food insecure households. That's really, really high compared to national data we have from Canada. Now, this is going back a bit to 2022, but that it hovers around 12% nationally, so to be food insecure. So this is super high. We can maybe talk about what's going on with this in the discussion, but certainly I think the cost of living crisis that people are experiencing in 2024 is, definitely there are more food insecure people, households than there were previously. And I think also many of the people who did this survey probably are, having some financial challenges, and that might make them more interested in doing and participating in a school food program survey. We had, because we were recruiting only using Facebook for the survey at the beginning, and we targeted to Peel and Hamilton, but only about 4.5% of the participants that we know of are from the Peel region. We asked them to disclose their first three letters of their postal code. 16% of our participants didn't want to do that. So some of those people may be from Peel as well. But the majority were from Hamilton, and that's probably again through the advertising through the Hamilton Wentworth District School Board. And in terms of annual household income, we had quite a variety of different income levels. 24% were over 150,000. This is combined annual household income. And then we had others in different income levels, but the majority were under the 100 to 150,000 range. And then we had we asked parents to tell us about what kinds of programs they had at their schools. So this is what parents knew about what existed at their schools. 151 of the 267 parents said they had some kind of program available at their kids' schools. And then they broke down with the types of programs available. Most of them mentioned student nutrition program as available. And then 59% said that they had, that their child participated in one of these school food programs. So we asked them about their preferred kind of qualities of their school food programs. And we basically asked them to rate these statements as agreeing, strongly agreeing, or on a scale to disagreeing strongly. And so this list shows you the percentage of respondents who either agreed or strongly agreed to these qualities in their current school food programs. So 66%, this is the highest number of people that agreed or strongly agreed that the programs meet their children's food preferences, followed by sense of belonging, meeting children's nutritional needs. And then it goes down from there to the lowest, only 30% of parents, oops, sorry, I mean to switch that. Only 30% of parents said strongly agreed that this improved their family finances or freed up time. 34% freed up time for the caregiver. So we then went on to ask them about a future national school food program. And we found that overwhelming majority, so 96% of parents said they would participate or have their children participate in a national school food program. And 77% said they would pay some amount towards that, which is quite high. So very enthusiastic respondents in the survey. We asked them about kind of what kinds of food they would prefer. 77% said they prefer lunch and 14% breakfast. We then asked them about barriers to future programs, and so to accessing future programs. And we asked them actually to list their top three barriers. So 52% of the respondents said that affordability, cost, accessibility would be the top barrier. So it would have to be affordable. 39% mentioned something about their children being picky eaters or food preferences of their children or concern about food waste, like kids not eating the food in a program, and that would be wasteful. 32% said time, supervision, organization of a program, depending on how it was organized, and time of the food and so forth, supervision would be a barrier. 21% were listed food safety. 21% listed dietary needs, and that included allergies, religious food restrictions. Many people mentioned need for halal food, and even things like sensory issues, like children who have sensory issues with food. And then finally, there was the problem of, or the concern rather about food quality and the healthiness of it and the variety. So that would be a barrier if it didn't meet their needs for those. So again, asking about preferred qualities of the future NSFP program. So this, again, similar to when we asked them about their current programs, we had these statements and we asked them if they agreed or strongly agreed with them. In terms of food, hygiene, and safety guidelines, 95% of people strongly agreed or agreed that would be, a very important quality of a future program. Healthy food offered, 92%. Enough time to eat food, 88%. Accessible by most children, 86%, and so on. And just under half people, I'm going to the bottom here, 48% agreed or strongly agreed that they would want children to be involved in some kind of food preparation, and 48% wanted the food to be culturally appropriate. So that was the sorts of things that they wanted to see in a future program. So that was the survey. Now I'm going to go on to talk about the focus groups, where we had more detailed discussions about some of these survey topics. And I'll just give you a little bit of a demographic profile of the 27 people who participated in these focus groups. Again, we had more women, many more women represented than men. We had a little bit more diversity in the focus groups. So we had 59% identified as white, and 40.7 or almost 41% were racialized. And the household size, again, pretty comparable to the survey. Most people were living in a household of about 3 to 4 people. And then we asked them, again, like in the survey, we asked them to reflect on the current school food environment. And majority, I think all of the parents actually talked about, sending lunches with their kids to school. And we had quite a lively discussion about that. Parents were quite stressed about preparing lunches, mostly because they were struggling with the kind of balance of trying to get healthy versus what the preferred foods, the foods that their kids preferred. And so there was, a lot of talk about what they sent for lunch and what was eaten and what wasn't eaten. They also talked about a lack of time at lunch. So a lot of discussion about kids not having enough time to eat their lunch, and some concerns about supervision. They weren't really 100% sure what kind of supervision kids were getting at school. So they weren't necessarily saying there's not enough supervision, but more, we're not really sure if they're being supervised and how. And there were some concerns of some parents who have kids with food allergies and that sort of thing, who were more worried about supervision. They talked about the student nutrition programs. And what we found was that there was kind of a lack of understanding or knowledge about the student nutrition programs. Some a few of the parents were unsure who the program is for. So one of the parents said, for example, that um, my child is not financially in need, and they were wondering if their child should really be participating in a program like that. They said even their kid expressed concern that they might be taking food away from other kids in their class that might need it more. So that was kind of interesting to see that they weren't clearly, they didn't clearly understand the objective of student nutrition programs. Parents weren't always sure what foods were offered, and there was concern about lack of consistency around healthy options. And I guess that was some concern that there was more of some types of foods than others. They did mention things like they were concerned about maybe granola bars or something like that that might be not as healthy as the fruit and vegetables, and wondering about the balance of those in the student nutrition programs. So a few quotes to illustrate some of what parents were talking about. This was a quote regarding, whether or concerns rather about kids not eating their food at school that they bring from home. So if he does bring something home, it's that he didn't get time. He always says that he didn't get time to eat it. So not enough time to eat, and therefore sandwiches are coming home or things that parents pack. And whether this is I think there's some reality to this, and also sometimes some kids may be using this excuse. It's hard to say for sure what's going on in every classroom. And then the questioning about the student nutrition program. I don't know. I don't know who's providing it. I don't know if it's constant, if we don't ever, not that I'm aware of, getting communication and newsletters. Now, again, it's not necessarily that the not getting communication from the schools. It may just be that these parents haven't paid attention. We don't know what's going on in the classrooms, but this is what parents were expressing, that they just felt like they didn't really know enough. And a number of parents said they did try to get information out of their kids about the student nutrition programs, but we all know that kids don't always talk about what happens at school. And so it's kind of hard to get information from them from home. So there's some frustration around that. So then we went on to talk about the future National School Food Program. And these are some of the key benefits that parents listed. So improved nutrition, food security, and health outcomes, reduce financial burden on families, increase food security, exposure to diverse foods, social benefits of eating together, and opportunity for cultural learning and community building. And then finally, enhanced learning and behavior outcomes. So if we again look at some of the future preferences or preferences for the future NSFP, many parents mention food. So they want healthy, high quality food, a lot of choices and variety, and mention cultural inclusion as well. So that the food would be reflective of different cultures, but also that they would be aware of some of the food restrictions or needs of different cultural groups. And thinking about the program structure or funding and funding, most parents were pretty adamant that they wanted it to be available to all students, affordable for all students to avoid stigma or exclusion. We did have a few parents who did say that they were concerned that with limited funding, it may not reach the kids it needs to reach. And so a few parents suggested targeting specific schools or targeting specific students with programs, but the majority really kind of saw the pitfalls in doing that and did feel like it should be just available to all to make it less stigmatized and more inclusive. Talked about different funding models. Some said just we should be using tax money for programs and therefore it should be free for all. Others talked about donations, either sort of pay what you can, or parents who had the means would be donating money to the program to help those who didn't have as much money to be able to afford meals. And they also talked about wanting local involvement in the school food program. So that was actually a theme that came up repeatedly. So a few quotes then from parents. If the children are eating, the positives are 100%. Bullying is going to go down because their mood is going to go up. Concentration is going to be fantastic because now the brain has got food. And I would actually welcome it to have a very diverse, menu of foods. Let's invite all cultures and let's have an experience. We then talked about challenges in a school food program and some ideas how we might overcome some of those challenges. Certainly safety was an issue. Worries about food safety and student involvement. So, again, number of people with either kids with allergies or, just general issues around food contamination. And so whether their kids could be involved was a concern. And again, more specifically, diverse dietary requirements. A lot of discussion again about halal food and the importance of maintaining a program that would respect that. And then everybody identified logistics issues. So not having the space or kitchen equipment available in schools, elementary schools in particular, the labor that goes into running such a program, the funding, as we've already talked about. Couple of ideas, couple of parents suggested creating central food hubs so they could see like community centers or high schools with well-equipped kitchens might be a place where food could be prepared and then brought to schools, elementary schools where there are no facilities. There was a fear of big food companies being given contracts to run a school food program, national school food program. One parent specifically mentioned Chartwell as a food company that they would not want to see running a school food program in Canada because they felt like it would be about profit and the food quality would be compromised. So again, this idea that most schools don't have kitchens. So the question is, we can't go probably putting a kitchen in every elementary school at this point. So obvious logistical challenge. And then concerns about food safety, who will be responsible for that? Who will control all these small things? So I think it's not safe to feed the children with something that was self-grown or self-produced. So that was where a bit of debate came in because many parents did say they wanted their kids to be involved in like growing food in school gardens and then maybe involved in some of the food prep. And then this other parent had expressed a concern in general about food safety, but also, when kids get involved, might it be harder to kind of monitor the food safety? Okay, and so I'm going to go on now to talk about teacher interviews. And these were 6 individuals from 4 different schools in the Hamilton Wentworth District School Board. And we got quite a representation actually from different grades in elementary schools in Hamilton. So we had one teacher and one educational assistant who were both in a JK SK class. And then we had one teacher from each of grades 3, 5, 7, and 8. And they came from 4 different schools. One was described as suburban/rural and quite affluent. Another were in urban, low to middle income neighborhoods in Hamilton. And then one suburban described as kind of mixed income school. So asking them to talk about the current school food landscape, there was from majority of the teachers a real concern about food brought from home. So many teachers were actually providing snacks, or school offices were actually providing snacks for kids because a number of kids would come with no food at all or would come with minimal food, not enough to keep them going through the day. A lot of discussion about ultra processed foods. And often kids would just come with these kinds of snacks and not anything that was really going to fuel them through the day and be nutritious. So they said the students really appreciated the student nutrition programs, as did the teachers, because it did fill a gap for some of those kids who were not coming with sufficient food. And I have to just say it was kind of alarming what they were describing. They were a self-selected group, right? So they wanted to volunteer to do these interviews because they were very concerned about what's going on in their classrooms. But the things that they described were quite disturbing. They were also concerned about not enough food in the student nutrition programs, and they talked about how that had changed quite a bit over the past few years, that there used to be more food available. And of course, you all know that that's, partly the food inflation, and the budgets aren't going up enough to buy the food. So they were, struggling with having enough food in some cases for their students. There were mixed thoughts on whether they had enough time. Many of the teachers thought that they didn't have enough time. One teacher did say, though, that they thought that it was just sort of how the students used their time, that they chose not to necessarily eat during their nutrition breaks, and that they would sort of want to be rushing out to go to recess or socialize. So a little bit of debate, but certainly in Ontario, we have the 2 nutrition breaks. So that's 20 minutes in the morning and the afternoon for kids to eat. And so some teachers didn't think that was a great situation, that 20 minutes wasn't enough. Some quotes from some of the teachers. And this was I believe, a grade 8 teacher who was in a school where there were kids who she felt were just not getting enough food or nutritious food. I know it exists that if kids aren't eating, they're not learning. If they're not eating, their mental health is in the can, right? So it's the most basic thing, and we just need to do a better job of it somehow. And in the last 2 years, it is so bad. It has gotten so much worse. So thoughts about a future national school program, food program. Very strong support from the teachers. They always mentioned that they thought it could help by reducing the ultra-processed foods which are coming from home, provide nutrition consistently for students, and improve mental health. And some of them were quite enthusiastic about including student food programs into the curriculum, thinking about food literacy, growing food, which might be, part of their other subjects like, growing food biology, part of their health curriculum. And they also talked about in cultural inclusiveness, They think a school food program should represent the cultural diversity within a school. They said they've been encouraged by the board to represent cultural diversity within all their other materials that they do in the classroom. So why wouldn't food be something that we would try to do like that as well? Some quotes, some quotes from the teachers. I think there's a lot to be gained from that. And then just teaching kids about healthy options, how to take care of their body, what balanced food looks like and tastes like, how to take a risk in eating and socializing. I think it brings a lot more than just nourishment to a school. And the teachers and parents did mention this kind of social aspect of eating as well, that they thought a school food program could bring a kind of a, rather than kids sort of eating at their own desks and eating their own food, that they could be sharing food together, like they're doing now with the student nutrition programs, and it being a more social kind of experience. One teacher said, we looked at some schools in other countries as part of our learning and health with the grade eights. Yeah, they looked at a little school in Japan where the kids grow their own food and make their own food and serve it to each other. And they were like, why can't we have that? That would be so great. Do schools in Canada have that? So I thought that was really lovely. Teacher sort of echoing what some students are expressing desire for. So challenges, they talked about challenges, participation, inclusive participation, the cost of food. So again, they were very adamant that it had to be available for everyone. Concerned about some dietary requirements as well, similar to the parents. They more so than the parents emphasize labor concerns. They are, very concerned about having enough people hired to run these programs because they are, already see that, many teachers, parents, and others are volunteering to do this work, and they can, if it got bigger, they were couldn't imagine how they could get more volunteers to run programs. And then again, the logistical challenges, not having the facilities mentioned already by the parents, and then the timing of food. So there was kind of a lot of discussion about when the best time for these school food would be. Any teacher who was in a classroom with an early bell time really would like more emphasis in the morning and with breakfast, and then those with later bell times, so that when kids started school later, they found that kids sort of crashed in the afternoon. And so they would want sort of a more lunch or later type of food delivered. Also, a lot of concern about environmental issues. And again, some parents brought this up as well, as in terms of food waste. And they mentioned things like packaging, like they wouldn't want a lot of single-use plastic and that sort of thing in any program. Again, a quote, this is again referring to the balanced day model in Ontario. I'm not sure how we would work with the two-break model that all of the schools have adopted. I think that would be a challenge unless you continued that snack program in the morning and then had a lunch program in the afternoon or vice versa. And again, discussion about cost. The majority of parents, it wouldn't be a burden to have a cost involved, but when there's a cost involved, we're not reaching the kids that it needs to reach, in my opinion. Okay, so that's the end of sort of each of those different groups in terms of what they were saying, and then just some overall key findings from the study. Again, huge support from parents. Barriers, cost, affordability. So again, this concern to make sure we have inclusive program and that everyone can afford to participate in. Concerns about child food preferences and food waste was also mentioned by parents in particular. Time, supervision, and organization. Again, the need for thinking really carefully about how these these programs would work in the school during the school day. Concerns about food safety and dietary needs, and food quality and variety of food. Again, benefits were creating a mindful food environment. So a lot of people, again, talked about this kind of eating as not just being cramming the food in your face as fast as you can so that you can get out to recess, but more like thinking about eating more mindfully. Nourishing kids and presenting new foods to kids was also something that was important. And then again, as we mentioned already, the concerns around logistics around implementation of such a program, which are obviously huge. So I divided these recommendations into two groups. The first is to think about access and logistics to such a food program. So again, recommendation that it be universally accessible so that every child, either it's free or it's affordable for every student. Thinking about some innovative funding models. There was a variety of different suggestions by people. Again, the sort of pay what you can model, or thinking about, one person suggested, some kind of corporate food corporation tax that would go specifically to the school food programs. Again, a desire for something local. So some kind of centralized preparation, but thinking about it in a local way. Again, maybe like a food hub within in a neighborhood with different schools in it. Adequate staffing is definitely necessary. Robust food safety. Concerns about allergies for kids. High quality meals with diverse cultural options. And then thinking more about recommendations for community and environment. Again, including educational components within the classroom, which could go broader out into the community as well. Involving students, and that again was a bit of debate at which level students should be involved in, but certainly at a minimum, thinking about serving food or preparing some preparation of food. Include community and building program to meet needs, and that was thinking about also getting food from local food producers, farmers, and food producers in local areas. Environmental sustainability, again, thinking about food waste and also how do we serve the food and what kind of packaging. Partnering with local food providers. So again, part of this idea of community where we think about sourcing food from local farmers or businesses within school areas, communities. Opportunities for communal eating, which I've already mentioned, again, was very important for people to think about their kids eating together as opposed to separately. Clear communication programs for goals with families and school staff with proper evaluation. So certainly, as I said, I think we found that there was some confusion about current school food programs. And so clearly any future program going forward would have to be really big emphasis on communication and involving families and school staff in that process. And then of course, evaluating programs to get to make sure that they're meeting the needs. Okay, so I just want to acknowledge the parent, caregiver, and teacher participants. They were really forthcoming with their time and knowledge and information. And so I really appreciated all the sharing that they did in this study. And to the research assistants that from McMaster and from University of Saskatchewan that were really necessary in order to get the study done in a short time period. The Research Analytics Department of the Hamilton Wentworth District School Board, and Bharavi Kumar from Taste Buds in Hamilton, and Andy Cito from the YMCA Student Nutrition Program. They were both really helpful in terms of consulting on the questionnaire survey that we did with parents. And next steps, hoping to maybe get some more funding to scale this study up to include, to extend it out to Saskatchewan and Nova Scotia, so not just Ontario. And be happy to get your thoughts and questions at this point.
Thank you so much, Tina. That's a lot of information, and it's great just to confirm with folks that we will be sharing the slides out after the presentation, so folks will have the opportunity to take more of a look at it. So we do have some questions in the chat, and folks may also have questions that they want to ask verbally. We have about 10 minutes. So maybe I will ask a couple of the questions in the chat, and Carolyn, if you could keep an eye on hands that come up in the group. So just a short clarification that came up about the lunch versus breakfast preference from parents, and just confirming that number. So it was 14% who said they would prefer breakfast, and was it 77 who said they would prefer lunch?
Yeah.
Do you remember that? Okay.
Yeah.
Great.
So,
Okay.
and then there were lots of people who didn't answer. I mean, this is the problem
Right.
with these surveys. We can't force people to answer everything. So, yeah.
Okay. But of those who did answer, 77% preferred lunch. Okay, that's a big difference. And then one question came about you mentioned you had 6 questions to assess food insecurity in those answers. So there is a question about a bit more information about those questions.
Yeah.
If you
So
have
this is a 6 shortened. It's based on the USDA, United States Department of Agriculture, survey about food insecurity, which the Canadian Community Health Survey also uses, a kind of a modified version of that. That's a long sort of 18 question survey. So this is a short 6 questions, and those I can't think of all 6 questions off the top of my head, but they're questions like, are you worried about food? Have you ever skipped a meal? That sort of thing. They're sort of some of the key questions that are asked in the longer version that are shortened to the 6 questions. So it's not as accurate as the 18 question, but because we know that people, we have to keep the survey questionnaire as short as possible so people don't give up on it. We reduced it to the 6 questions, and that is something that is used in other questionnaires. It's not something we came up with. We used the 6-item module. And then it breaks out. I didn't show the breakout too, but it breaks it out into like marginal, or severe food insecurity. So there weren't many in the severe food insecure category, and I'll be sharing the study with you so you can see the study report, so you can see the details of that. But there were again quite a few people that were high percentage that were deemed food insecure, even if it was marginal.
Thank you. And then Laura brought up, I think this did come later in the discussion, but was asking about how students use their time to eat may be impacted by whether there's actually a space that's dedicated for that. And it sounds like that did come up, but is there more that you would want to say about those conversations?
Well, in Hamilton, at least, I'm pretty sure all the teachers said, and from my knowledge of what goes on in Hamilton schools, most kids just eat in their classroom. So they just at their desk. So there's no kind of space. There's a thumbs up there from Sharon Smith. I'm assuming you're agreeing with that's what goes on in Ontario. So yeah, so it's not necessarily a space issue. It's just there could be many reasons why they don't have enough time, but certainly that was voiced by both, well, mostly parents. I did ask teachers specifically about that, and some of them agreed. I mean, a lot of the parents would say that the teachers would say that they're just socializing, right? Or one of the teachers actually was very adamant about that, and they're just not eating. And the other concern they had was they would eat their snacks first, and then they would maybe get to the sandwich at the second nutrition break.
Okay, thank you. Are there any other questions in the room? Oh, I see Laura there. Laura, do you want to just speak what you've just written?
Sure, that would be great. Thank you. Can you hear me well?
Yeah.
I'm just not going to turn on the camera. It's still very early here. Yeah, I was just going to say, I think as I work here in BC and Island Health as a public health dietitian, and some of the work that we've been doing going to schools is just also just sharing, when you talk to teachers and staff and doing professional development, to sort of, just let them know that there is food insecurity going around. And then, of course, that impacts food choices. And so we're just encouraging people in schools to be mindful that to just try not to judge students, especially for what they bring, because first of all, that's not necessarily most of the times their choice. It's influenced by what their parents are able to afford. And so throughout the presentation, and this is not a criticism to the research team or anything, but just I saw that there was a lot of from the participants in the project, a lot of comments about healthy food and all of that. So just making sure that I think it's a job for all of us involved in this work to make sure that when the National School Food Program comes in whatever shape and form, to make sure that it's not used again to further stigmatize, and that because we were talking about stigma in terms of like who's going to access or not, but there's other pieces of stigma that can happen. So just to be mindful of that as well.
Yeah, that's a really great comment. So, I mean, what I'm sharing with you today is like raw, that's what the teachers were telling me. And one teacher did mention that in the past, they used to do things like tell kids they have to eat certain foods first. And there was like a lot of kind of judgment going on. And they have been getting some board directives not to do that. And not to be kind of judging food. And so they did mention that, but they still wanted to talk about the food, the quality, like the junk food as they talked about. So yeah, no, that's a really good point. And also, I didn't have a chance to put in the presentation, but there was one comment. We did have some open-ended comments on the survey, which some people just volunteered to write a few things. And one parent said that they wanted healthy food, but they were really concerned about this kind of good, bad food judgment that's going on, that sort of binary of like food is either good or bad, healthy or not. And so they're concerned about like that, also leading to eating disorders and all sorts of things. So that was interesting that one parent did raise that issue. And I think, yeah, you're absolutely right that it is a problem in terms of what goes on in the classroom and that sort of thing. I mean, I guess the hope is that as students bring less food from home, there might be more, less of that kind of judgment going on.
Yep. So things to keep in mind for sure.
Yeah, thank you
proceed.
for raising that point.
I think we have time for one more question, and I see Darlene's hand is up there.
Hi there, Tina. That was wonderful. What is there going to be further expansion on this study or this research, and what can people do with it afterwards? Because some of the concerns that the parents raised, like too many granola bars, that's happening because fruit and vegetables are too expensive. So what schools are doing, and I know that, I used to be a food and logistics, so we ran the numbers. So we know that schools are giving them more grain products than the fruits and vegetables because of the cost. So how can we use this information, or, how can we get this message out to schools and stuff with this research?
Well, Um, the report is going out. We're trying to distribute it as widely as possible, and I would be really appreciative if you distributed through your networks. Um, and I mean, I guess the problem, I guess, is really one of cost, though, isn't it? As you mentioned. So again, we hope this National School Food Program going forward might be able to address some of those cost issues. But yeah, I mean, we also, like I mentioned at the end, do want to scale the study up a little bit so we go beyond Ontario. We're still, I don't know if we'll get funding to do that research or not. We're just putting an grant application in for that. But yeah, I mean, I would be interested to get your opinion on or ideas about how to get that information out to schools. It's gone
I
through
think
the school board level in Hamilton, and I know it's gone to obviously some of the people who run the student nutrition program now. So
I know in Hamilton, Baravi, you mentioned Baravi. So those partnership leads, they go out to school boards and make presentations to the teachers, to the principals and stuff. That's something that should almost be done yearly. It's time consuming, I know, but it's a big impact for them to hear and share that information, right? So that's something maybe across Canada, and I know it's already done in many areas, but again, it's the message that you can never stop giving that message, right?
yeah.
I know that Tina's email will be in the follow-up package that goes out to everyone with the recording. So I think folks can keep in touch with Tina and also with us at the Ontario Coalition chapter. And just if there are ideas, we can convene another conversation if people would like to. And then I think potentially reaching out to the student nutrition program coordinators and leads in the various regions, wherever you are, and saying, hey, I know about this study. How could we do something more with it? So, but feel free to reach out to Sarah or myself at the Ontario chapter if you're in Ontario. And then if you're in another province, we have coordinators in each province, some of who are on the call now. So this is great. Thank you so much, everyone, for coming today. Thank you so much, Tina, for this work and for sharing it, and to all of you.
It's a pleasure. Thank you
for spending time this morning.
Thank you so much.
Great. Thank you. Thanks so much for being here. Have a great day.
Bye, everyone.
Bye.
Thank you. Bye.